This segment of DelmarvaLife is sponsored by TidalHealth.
Managing illnesses presents a unique challenge to healthcare providers. It can be difficult, especially in rural areas with limited resources to provide the highest quality services that patients require.
But thanks to a new partnership between some familiar names, a collaboration is moving forward, and its goal is to set a new high standard in the form of home health care. And you probably recognize Beverly White, the Vice President of Business Operations with TidalHealth Home Care. Welcome.
Thank you.
Yeah, so I guess this is big news. Obviously, Peninsula Home Care has adopted the TidalHealth name.
Yes, we have. So TidalHealth and Peninsula Home Care have been a joint venture for quite some time. And as we are coming to our 40th anniversary this upcoming year, 2025, we decided that it was the perfect opportunity for us to finally adopt the name for TidalHealth Home Care.
Great.
So I want to jump into this feet first. Help me understand the distinction, the difference between general home care and skilled home care.
So general home care is what we consider custodial home care, which are services to help people stay at home for tasks like sitting services, when they need help with like cleaning their house or cooking, or maybe transportation for appointments.
Okay.
Skilled services are the things that we do that actually help people manage their health and wellness and their illness when they're maybe trying to recover from an illness or coming out of the hospital, or prevent going to the hospital, or maybe they have an illness that frequently requires them to go to the doctor or to the emergency department. So that's what we do.
Okay.
Okay, so let's talk about the patients a little bit. How does the collaboration between TidalHealth's case management, discharge planning teams, and services ensure that smooth transition for the patients?
So what happens is, we know that as patients are coming into the hospital, we know that they're always starting, as soon as you get there, starting looking at your plan of care while you're in the hospital, and are already looking at what's going to happen when you leave. Because we have one of our liaisons that is situated with the case management department, and they're already looking at what kind of resources patients are going to need after discharge and plan for them. So while they're in the hospital, we can already start networking and looking at the resources within the TidalHealth system. And now that we are better aligned and part of those resource network, we're able to then ease the facilitation for patients to get the home care services they need, often the same day or the very next day after leaving the hospital, or even from the emergency department, because we're able to connect them from case management and from the hospital to our liaison, right to our department,
So
from a home care agency.
Does this reduce visits to the ER?
Yes, ultimately it does. We've been working really hard over the past year, most specifically with our congestive heart failure patients with TidalHealth, and that was a big catalyst for part of this name change. And we have found that with those patients, we have reduced our ER utilization and readmissions to a less than 1% margin for those patients, for the congestive heart failure patients, that the patients that had historically been going to the ER a lot, frequently, and been readmitted, we've been able to keep them out of the hospital by putting them on our congestive heart failure patient and monitoring them and educating them at home, so that it does reduce that utilization on the hospital, so that it can ultimately reduce wait times in the ER for other patients that may be coming in for other emergent needs. So it does reduce that burden on our other part of our partners in the system and the community.
Two birds, one stone.
Yeah,
absolutely.
Wonderful. So how
Absolutely.
does one acquire home health services?
Well, the wonderful thing is that we are still the same agency. It is the same offices, same clinicians. We are the same quality team. Everything remains unchanged for the past 40 years. We are the same people we've always been. So we are in the same locations in Salisbury and in Delaware. We provide the same service areas, the same phone numbers. So you can still call us. You can still access us the way you always have by calling our offices or coming. You can still ask your provider for us. The only thing that changed is that we are now better able to provide additional resources within the TidalHealth family.
Perfect.
Wow.
Thank you so much,
Yeah.
Beverly
Thank you
White,
so much for
coming
having
in
us today.